Hi everybody, it's Zsuzsoka Kecskes here from the ANU Medical School, bringing you the news from today, the 31st of July 2020. Thank you to all of those who attended the mid-year faculty meeting last night. You would have heard Professor Ian Anderson, who is the Deputy Vice-Chancellor for Student and University Experience, talk about his career, his experiences in medical school, and what he's learned since he's been with ANU since March this year. And particularly interesting was were his ideas on student experience and how what we're experiencing now will really be the new future and how we can make the best of that. During the faculty meeting, you also got an update from me from the last very turbulent 6 months, and a fantastic panel consisting of Dr. Nikki Schembri, who's our student support and well-being faculty leader, Sam Garami, the president of the ANU Medical Student Society, and Sally Lawton, the wellbeing officer of MedSoc, talked about their experience and what they've learned in terms of leadership and teamwork, but also opportunities for the future as panel members. The event was recorded and we will send out the link, and I will also make the PowerPoint slide of my presentation available to you. As you also know, Professor Grun held a town hall meeting last week talking about the School for the Future and the new task force that is being set up to think through function and strategy as well as structure of the medical school. The report and the recording of the town hall meeting are now available on the College of Health and Medicine intranet. And the latest on COVID-19, the travel restrictions from Victoria stay in place. There are New South Wales hotspots, and that's been updated on the app or on the tool that Canberra Health Services now uses. Remember, if you've got any symptoms, please talk to your GP or get tested. For those of you who are attending any of the health service buildings, remember to fill in the app, get the green tick, and then at Canberra Hospital and at Calvary, go to one of the stations where you will get a sticker for the day, as I've got here, so that it is clear when you enter the building that you've been screened for the day and it's okay for you to enter. Now, as you know, we are very interested to hear from students what they think about our teaching over the last 5 months, particularly to find out what they thought, how we delivered the learning outcomes in our e-learning tools. The survey has been sent out for the years 3s and 4s. We do not have enough of the year 3 and 4 students yet who filled in that feedback. Please do so as soon as you can. Unless we hear what you have to say, we can't make any changes for the end of the year, and particularly for the next year or the years to come. And we'll have a feedback form for the years 1s and 2s soon as well. And speaking of online learning, you know that it is really the TELT team that has made the successful transition to online learning for our students possible. The TELT team is now developing more online training for teachers, whether that'll be face-to-face or online. Please watch out, they will have this publicized very soon. And just in case you are thinking of what teaching would look like in the future and you're thinking through some kind of learning technology, before you come to us and ask us to buy that, please go to Associate Professor Alex Webb, the leader of the TELT team, to look at that technology and see where that fits in with our other strategy and other technologies. And apart from the new staff that I've welcomed in last night's faculty meeting, here are some other members of the medical school that we'd like to welcome. So Dr. Georgia Pike is a postdoc fellow and she's working on a COVID-19 project. Vin Vijidasa is a learning designer working for the TELT team, as is Dale Newberry. And as stated last night, Gary Lum, who's a Principal Medical Advisor at the Chief Medical Officer Group, is an Honorary Professor of the medical school. Welcome to all of you. And here's some really exciting news. Catherine Parker, who's one of our MCHD PhD students, has been awarded the very lucrative John Frederick Sprent Prize, given out by the Australian Society for Parasitology. This prize only gets given out every 3 years, and it is for the best PhD. Congratulations, Catherine. Now, for the medical students, particularly as exams or even end of medical school and an uncertain future looms, we are trying to support you with your worries and concerns if you have them. The year coordinators are there for you. They help you with financial support or advice rather, academic, health and well-being as well. And they do have close links to the academics, the clinicians and to the executive. If you've got any concerns about that or any kind of behaviors that you see that worry you amongst your peers or amongst clinician or professional staff, come and talk to us and we'll listen and we'll see how we can help or what kind of things we need to address. And the latest news and research is about Professor Chris Phillips. Her and a team of, from different universities have been successful in getting an MRFF grant for over $800,000. And this is for a project for a good start in life for young children, reducing vulnerability and health inequity. Congratulations, Chris and the team. And in the media this week again, we've seen Professor Chris Nolan in the Australian Financial Review, Professor Peter Colignon in the Sydney Morning Herald, The Age and Bloomberg News, and Associate Professor Sanjaya Senanayake in the SBS News. Those of you who would have tuned in to the Medical Dean's ePortfolio webinar were lucky to hear the experiences from other schools using an ePortfolio for their medical students. If you've missed out, the recording is now available on Basecamp. You just have to Google Basecamp and public ePortfolio and you get the link. We'll make the link available in the newsletter next week. And as stated last week, there's a webinar on the 5th of August on assessment, best practices for design and measuring success. You need to register for this event. And I think that's all from me for this week. Thank you for attending the meetings that we've had over the last week or so and tuning in. Remember, if you're unwell, if you have a new onset of a cold, if you've been in one of the hot spots or you're just worried, go and talk to your GP, get tested. In the meantime, look after yourself, each other, your family and friends. And if you've got any ideas, any feedback, please email us at the email addresses below. Have a great weekend and I'll talk to you next week.